Okay, welcome everybody to our BulletPoints lunchtime webinar series on firearm injury prevention for clinicians. I'm Dr. Amy Barnhorst, and I'll be moderating today's session. We're really excited to have Dr. Chris Knoepke, who's here to talk about his mixed methods research and how he's engaged firearm owning communities as central stakeholders in firearm injury prevention. First, a few announcements. Mark your calendars for every third Tuesday of the month at noon Pacific time. This is when we have our webinars for just a quick 30 minutes. You can sit and eat your lunch while you listen and learn about firearm injury prevention. And the next webinar will be on April 19th with Drs. Patricia Logan Green and Mickey Sperlich at the University of Buffalo. They're going to talk about the role of social workers in firearm injury prevention. And at the beginning of each webinar, we will have a very brief poll, and these help us understand where you're coming from, what you know as our audience, and what you learn from our webinars. You'll also see, excuse me, a question on the poll asking about your profession. If you select other profession because you don't see yours, please write your specific profession in the chat. This helps us understand, again, who's in our audience. And we really appreciate you completing this evaluation. There'll be another brief one at the very end. So we'll launch the opening poll for everybody to go through now. It shouldn't take more than a minute or two, and then I will introduce our panelists. Okay, great. Thank you everybody for completing the brief poll. And moving forward, the chat is going to be disabled. So please use the Q&A function for questions. If there's something really simple or urgent, I'll respond to it immediately, but otherwise I'm going to save all the questions for the end and give them to Dr. Knoepke. And without further delay, I'd like to introduce Chris Knoepke. He is an assistant professor at the University of Colorado School of Medicine. His research largely focuses on helping patients and clinicians navigate technologically complex, emotionally charged, or otherwise difficult decisions about care, including those about advanced cardiovascular illness or when a patient is at risk of suicide. He's a social worker by training and in his heart, and he brings the perspective of community-based prevention methods into all of his work, including incorporating the views of those charged with actually doing an intervention into its development. He also recently wrote a blog post for our BulletPoints project, and leading up to today's webinar on finding common ground, engaging the firearms community in firearm injury research. So please check out his blog on our website if you haven't already. And thank you so much for being a part of this, Chris, and I'll let you take it away from here.
Wonderful. Thank you, Dr. Barnhorst. Thank you, everybody. It's wonderful to be here and to get to do the work that I do with BulletPoints with UC Davis. More generally, huge credit to Garen Wintemute and Veronica Pear and Rocco Palin and all of you folks, as well as Emmy Betts and Joe Simonetti and many of my colleagues who do firearm injury prevention work at the University of Colorado. I'm also very proud, as I heard that description and what's upcoming, to be kicking off this sort of role of social work in firearm injury prevention, as my description, which my bio I wrote a few weeks ago, not knowing this, says I am a social worker, both professionally and at heart. And today is World Social Work Day, which I actually learned this morning, but it's a perfectly appropriate way to kick this off. So, but at any rate, what I'm here to talk about today is engaging firearm owners in firearm injury prevention. I'm going to focus on some of the work that we've done in firearm injury prevention research at the University of Colorado in collaboration with several other groups across the country, but with a major eye toward what the role and culture of firearm ownership is. First, here are my disclosures. There's no major conflicts that I would have to discuss here, but I want to start by focusing a little bit of attention on, what dissemination and implementation science is. So D&I scientists like to sort of bemoan the bench to bookshelf phenomenon, which is this, the sense that things that we discover in the laboratory or in clinical trials or whatever else, there's on average a 17-year gap until they get implemented into real world practice. And most findings never reach their full potential due to voltage drop in real world settings, lack of uptake, and other problems. But we in firearm injury prevention know that it can be a lot worse because our findings get sent through the crucible of a real honest to God culture war that can distort either the meaning of what we find, our motives behind finding it, or both. This picture is actually of a real magazine cover I took while waiting in line for coffee at a grocery store, Starbucks in Colorado Springs, Colorado. And what I wanted to highlight on here is this gun law apocalypse. And so it's very easy to think about any sort of policy or safety intervention that we do getting misconstrued or distorted because of this culture conflict as something that would be terrifying to a certain subset, I think you would say, of maybe the gun owning population. Although this is absolutely a caricature of the gun owning population. I'm going to focus on that a little bit more here because it creates this problem. There's a tension here, because the most recent Gallup estimates hold that at least 44% of Americans live in homes with firearms, and right about a third personally own them. Our interventions invariably require at least tacit approval from the firearm community, in the same way that new medications require at least tacit approval from doctors and nurses. They're the people who will be implementing it. No matter what the intervention itself is, the firearm community is going to be involved to some extent in implementing and making sure that it gets maintained. And if most people in the world are good, as I would hold, then it stands to reason that most firearm owners in the world are likely to support some proportion of the safety programs, interventions, policies, and other ideas that we come up with in our work. The notion that reducing firearm injuries, whether accidental or resulting from violence, that it requires incorporating the perspective and gestalt and the worldview of firearm owners isn't new, obviously. So at Left, both Emmy Betts and Garen Wintemute wrote this editorial in JAMA calling for firearm ownership to be understood as a culture, which absolutely makes sense when we sort of expand our definition of culture beyond the things that can be defined by what appear on the census. And at the right, there's a screenshot from the Affirm at the Aspen Institute website. So Affirm, if anybody doesn't know, sort of acts as something of a firearm interested think tank. And they name firearm industry experts as a critical stakeholder group within their leadership. This isn't only to allay concerns about credibility of their ideas among firearm owners, although I'm sure it is also that, but it also speaks to the idea that cultural mores of firearm owners can be meaningfully integrated into the products or recommendations that are made. I'm also not the first to lay claim to the idea that the broader culture of firearm owners is made up of distinct set of heterogeneous groups. Many of you know, and many of you may have been involved with the group at the top. So a latent class analysis, which was published in Injury Prevention in 2020, led here by Julia Schleimer, which found 5 latent phenotypes of firearm owners, which were defined broadly along the lines of how many firearms they own, their stated reasons for owning them, how often they handle them, how do they store them, those kinds of factors. And then at the bottom, many of those findings were echoed in Ali Bond's dissertation, many of which, portions of which were just published in Suicide and Life-Threatening Behavior. But she added on top of that, that one area in which these distinct forms of firearm owners had similarity was with groups they saw as trusted messengers of information related to suicide prevention, including for lethal means counseling or for any other sort of suicide prevention messaging or safety messaging. This was good news for the American Foundation for Suicide Prevention, law enforcement leaders, and family members of firearm owners. It's bad news for the NRA and NSSF, who are not seen as credible in this area by a broad spectrum of reasonably representative groups of firearm owners. So when we say people who live in a home with a firearm, when we say firearm owners, again, this is a pretty heterogeneous group, but both Dr. Bond and future Dr. Schleimer's work highlights a cogent sort of typology of firearm owners, which we see in our qualitative work as well. And what I'm about to lay out is not necessarily meant to be heuristic and can't account for all reasons for firearm ownership or all types of firearm owners, especially among communities of people who tend to be underrepresented in firearm research. But it's meant to sort of give us a little bit of a taste of some of the differences here. At one level, you have maybe a very casual, maybe new firearm owner who may, you know, as illustrated in this picture here, store their firearms in ways that we would not ever advocate for, the loaded on the bedside table kind of person. This person might not have a lot of family history with firearms, perhaps outside of this sort of personal protection handgun. There's a lot of these folks since the pandemic started, which we've seen in a lot of work. This person might not have a lot of training or social reinforcement of safety norms and culture, but also is not likely to voice a tremendous amount of opposition to safety policies or intervention. They're also not terribly likely to take part in firearms related research unless we can find them through indirect methods, which we've had some success in doing in some of our projects. Next, we have sort of a couple of groups of people who live in homes with firearms, but don't consider themselves the owner of the firearms themselves. And while these pictures both depict women, we shouldn't imply that these are all women, although many are. There's a few distinct phenotypes within this group too. The first, as you can see at the top, is pretty dismissive. They're a bit like the first group that I was talking about, in that they're disconnected from firearm culture and training, but that's because they don't consider firearms in their home to be within their personal purview. They might not even know what or how many firearms are in their house. Some of them might even prefer not to have firearms, but tolerate them, sort of as out of support for their partner or their family's passions for it. And then the other, with the gentleman in green with the woman, is a bit like number two, but still slightly more engaged, and yet still ambivalent about firearms within their house. They support their partners or their family, just like the second one, but they might know what's in their house, and they still defer gun-related issues to the owner. They vary considerably in terms of their own personal level of knowledge about firearms themselves. Then so those are the non-firearm owners, right? But then we come back to this gentleman again. So this is this caricature kind of, we might derogatorily refer to them as like a gun nut, which again really isn't fair, but it exists in a world which rewards political extremism. Irving Goffman might have called this sort of a front stage personality, which might conflict with a backstage personality, which is less engaged with the firearm culture. This is who the extremes within the firearm culture market to, and that's why this was on a magazine cover as depicted here. But probably not who we see in our studies, because if you were on this level of the extreme, these are also not people who tend to sort of take part in scientific research for a variety of reasons. These are people who are vocally very supportive of the Second Amendment. They may own a variety of firearms and participate in certain aspects of firearm culture. They're not always knowledgeable or engaged in firearm training or safety. They are unlikely to challenge a fellow firearm owner if they have concerns about their safety. So this might be sort of a challenge. Oh wait, here's where I thought it was, but here we are. Then we get to this highly engaged, but also very active firearm owner, this is the instructor in this picture. This is someone who devotes substantial time, effort, consideration to firearms and the associated cultural mores. They're passionate, longtime firearm owners. They practice consistently. They take the ownership of firearms very seriously, and the safety around it. They might quiz you if you're doing research with them about the 5 rules, like those kinds of things. They talk to others about firearm safety. They're careful to note the safety precautions that they take, even in casual conversations. Likely to own a lot of firearms, perhaps so many that they can't even realistically keep track of them. And so we want to consider that all of these groups exist within firearm owners when we're developing community-based or individual level interventions, and where we might actually have some malleable behavioral factors. So I'm going to take a narrative, reasonably qualitative, nonlinear approach to discussing some of the experiences we've had with 3 different projects. The first of which has to do with firearm storage maps. The second is one of my favorite projects of all time that got me into firearm injury research, called Loaded Questions. And then I'm going to finish up with a little bit of discussion about upcoming and ancillary findings from our development of the Firearm Life Plan. So in the voluntary temporary out-of-home firearm storage, this is an NIMH-funded study of the potential for voluntary temporary storage maps as a community-based suicide risk reduction method. So we conducted right around 100 interviews with firearm-owning individuals, including representatives from firearm advocacy organizations, law enforcement leaders, and owners of firearm businesses in Colorado and Washington. And one of the things that I think that I want to sort of drive home is that almost universally, members of the firearm community express a sincere desire to sort of be part of the solution, right? Among these people, and I'll grant that these people are more connected to the firearm community than many owners are, but there was very little in the way of like the slippery slope argument that we might worry about, as far as like them seeing a constraint in that we hear when we talk about other sort of safety initiatives. They would say that they want to help, and they know others within their community that want to also. This enthusiasm was sometimes tempered, and this is outlined very sort of neatly in this paper that was published recently too. This was also in Suicide and Life-Threatening Behavior. But this enthusiasm was tempered by a few concerns. Some of these concerns are pretty intuitive. So worrying about liability for loss or theft or damage of firearms while in their possessions if they were to take them in and store them for somebody who is in crisis. But they extended out to concerns about safety and liability associated with returning firearms to owners when they ask for them back. They would emphasize that they're not mental health providers, and it would make them nervous to be put in the position of knowing that someone had been in a suicidal crisis or had been sort of moving that direction, but says that they're now okay and wanting their guns back. This should guide the development of law and policy, which would need to be cleared up to allay some of these concerns among some of the more active members of the firearm community. But again, universally, they would say that they would want to save a life if they could, as a service to the community and as a service to the firearm owning culture. Excuse me. Again, so moving on to loaded questions. Again, this is one of my absolute favorite projects. This was Garen, Emmy, and Megan Ranney from Brown published an article called "Yes, You Can" in Annals of Internal Medicine. It was something of a call to arms clarification for healthcare providers. "Yes, You Can" was meant to imply that providers can talk to patients about firearms in the home as part of a normal clinical encounter. This paper got some attention in the press, as you can well imagine, because it sort of it latches into that culture war, including newspapers and sites that have comment sections appearing beneath each article. So we did a descriptive content analysis of the contributions of anonymous internet commenters when they're talking about how this paper had been interpreted by MSNBC, Medline, Fox News, and a few other places. I'll freely admit that this is the furthest thing from generalizable research, but it gets at extreme viewpoints in a way that other forms of research really struggle to do. Amongst all the sort of bluster and bravado that you would expect of an internet comment section, of an online anonymous internet comment section, there are a few themes that emerge as situations in which even the most vociferous opponents of firearm safety conversations with healthcare providers were seen as appropriate or even recommended. First was what we were interested in, was when the content of the encounter highlighted risk of violence directed at themselves or others. One even said, crisis or emergency intervention, absolutely yes, ask and intervene. And what I should say is all of these quotes that I'm about to outline were actually within comments that we'd coded as not being supportive in general of firearm injury conversations or lethal means counseling. The second, where they thought it was appropriate, was as part of general injury prevention education for parents of small children, as recommended by the American Academy of Pediatrics and others. The fun part about this was that after I did this, I actually busted my son's pediatrician on this. And even though she knows that we've had this discussion and I don't have firearms in the house, she asks me about this every time now, sort of as this like ongoing joke. But I'm very proud that I got her to, I think, at least think about asking that question of other parents that she sees. But at any rate, these conversations were seen as okay if the questions were lumped in with other dangerous household exposures like pools, chemicals, kitchen appliances, etc. The third was providing education about dangers associated with firearms was seen as appropriate as long as no one asked if the person owns them. And this actually echoes something that we see in a lot of our qualitative work, which is that firearm owners, at least in Colorado, and I'm sure it's true elsewhere also, tend to get reticent about there being kind of any record anywhere of who owns what firearms. So what people would say here is, it's okay to provide education, just don't ask me if I have any guns. And then finally, and as if to highlight the bigger point about the cultural divide, healthcare providers were generally seen as outside the firearm owning community and therefore lacking in the knowledge necessary to be helpful when someone owns a firearm and is in a dangerous or otherwise precarious situation. This might be true in many circumstances, especially for the more engaged firearm owner phenotype, but probably less so for the new casual gun on the bedside kind of firearm owners. And I clicked that before I was ready. But finally, I know that this links to this will get sent out as well. But we recently released a product emanating from an administrative supplement to a study of older adult driving decisions. And the tools function as planning support for decisions surrounding firearm access among older adults. Findings from the qualitative portions of this project, which included focus groups of older adult firearm owners, older adult veteran firearm owners, and family members of older firearm owners, illuminated some fairly common scenarios in which older adults either have firearms that they no longer need, use, maybe even don't even have interest in, and just sort of are there gathering dust, waiting to either for the person to die or to lose them, or for them to be stolen, or something else that we would prefer not to have happen. Owners told us, so the older adults told us that they trust their families to tell them what to do, but family members would then say, you know, when we asked them separately, that they're scared to bring it up out of the fear of angering, alienating, or embarrassing their family member. And these tools attempt to sort of provide a platform for that conversation based on what we found there. The tool essentially provides a roadmap to planning what to do with each firearm and using feedback from firearms themselves. We also don't ever electronically store any information. We suggest people print off the guides and fill them out by hand and sort of keep their own records for themselves. And if they want to use that to support a conversation with an attorney as part of estate planning or something else, then at least they have that, even though the tool that we created is not a legally binding document. I know that I'm running up on time, so I'm going to throw this up here at the end. It's been a wonderful experience to speak with you guys, work with you guys. Look forward to continuing to in the future and incorporating the voice and experience of firearm owners in the work that we do.
Awesome. Thank you so much for that great presentation, Chris. That was really interesting and so relevant to what we talk about at BulletPoints in terms of how, you know, we can educate the healthcare providers, but ultimately our target audience are firearm owners. And so if we're in any way alienating them or not including them, we're really not reaching our goal of helping prevent firearm injury. Before we go into the Q&A, and just a reminder to put any questions you have for Dr. Knoepke in the Q&A section, and we will go through them. We have a real quick closing poll. It should just, again, take about a minute. Okay, we have a couple of questions in the Q&A. So the first one, Chris, is, can you talk more about the generalizability of your findings about firearm owners? And is it possible to do generalizable qualitative research?
Right. This is an excellent question. And it speaks, I think, to the reality of what you do when you're doing qualitative research. I think qualitative purists would tell you that there is no claim to generalizability. What you're doing is a highly descriptive description or a characterization of the people that you are able to talk to without making any claims of that being generalizable outside of that, although we sort of imply that that these people's experience should be at least reminiscent to some extent of other people's experience. The way to strengthen that claim of generalizability are mixed method approaches. And I consider myself a mixed methodologist, where you're either doing sequentially or in parallel, something where you are you're either randomizing people to conditions, or you're attempting to sample in a representative fashion so that you can extend the sort of the reach of that research. But the deeper characterization and the ability to answer questions that you didn't even think to ask isn't possible unless you're doing qualitative work. So the approaches, I think, are complementary.
Yeah, and I love that piece about, like, you might not even think to ask these questions if you didn't have the qualitative piece, because we may not know, or we don't know. Right. And then what other firearm owning subgroups would you just personally like to engage in this kind of research? I
think that really strong Second Amendment advocate who will fight you about literally anything that sounds that as they'll say, like, smells like gun control. They're people who it's useful to get to, if only because of the sort of the bigger ecology of the conversation around firearms. They participate in the conversation around firearms, even if they don't participate in other aspects of the culture. So understanding their perspective in as much as they're willing to share it, which can be a challenge, I think would be useful to preventing firearm injury, at least in creating a sort of a messenger set around how to reach more casual firearm owners who don't really think about who they're listening to, but rather just hear the messages that are out there.
And sort of a corollary question, are there subgroups that have been particularly hard to reach, or particularly acrimonious in their engagement?
Yeah, I think that it's fair to say that sort of phenotype of the really highly engaged firearm owner who is engaged in firearm related activities, owns firearms, but doesn't necessarily connect to the safety culture, the training culture that surrounds a lot of firearm ownership, especially among veterans, that where training and safety is highly sort of thought of in general and prevalent, but also among firearm owners, frankly, who are not white men. So BIPOC firearm owners, LGBTQ firearm owners, these are underrepresented groups, and there's some emerging ideas as to why it's difficult to identify those people, but also their perspectives get sort of left out of anything that we think of as far as firearm safety.
Yeah. We have a request for you to share links to your studies, and that this was great information. So if that's something you can maybe put in the chat at the end, that would be great. Then we also have a question: if there's ever been a case where a gun has been voluntarily surrendered, but then returned when the crisis has passed, but then something bad has happened, and how, because that is the.
Uh-oh. Oh no, I'm gonna stop my share.
Hi, Chris. The question was, has there ever been a case where a gun's been, oh, we lost Chris.
Did we lose Chris? Is that what happened? I wondered what happened. Uh-oh. He's back.
Oh, he's back.
Did you hear my question, Chris? I don't know what happened there.
I heard the half, and I read the question as it was in the
okay,
thing.
great.
I'm sorry.
Great. No, it's okay.
Great time for the internet to get out. I think it's a very interesting point. Like, do we have any sort of documented instances in which somebody voluntarily gave up a firearm? It was given back to them after they decided, for whatever reason, that they thought they were okay, and something terrible happened with it. I don't know of any instances in which that's happened. It wouldn't be difficult to think about that somebody either harmed themselves or harmed their partner. I think is the bigger concern with that. But I don't know how realistic that concern is among for people who might provide voluntary storage. But that's something that maybe we ought to look into, so that when we are promoting this concept as a community-based firearm suicide prevention initiative, that we can say, I know that you're worried about that. Here's what we know about how often that actually happens, so that we can at least allay their concerns or attempt to.
Mm-hmm. Yeah, be great. Okay, for our last question, anything that surprised you while doing this research?
I think that the amount of diversity within the firearm owning community leads to some really interesting ideas about how to reach the sort of less connected firearm owners, right? Like there is actually, I think, and it's not unfair to say, there is quite a lot of judgment from more engaged firearm owners and more engaged firearm business owners about less engaged businesses, or ones that don't take that as seriously. And so I think that I think that gives us some opportunity, because the social pressure to be on the right side of things, I think, can be very powerful, especially among a group of people who consider themselves sort of right-minded protectors, doing the right thing for their community, by and large. I think that trying to motivate the people who might not be sort of following the sort of cultural script of like what is safe and responsible gun ownership, by creating new sort of expectations for that as a cultural artifact is interesting.
Yeah, awesome. Well, thank you so much. And we really appreciate having you come present for us. I hope everyone enjoyed today's webinar. And don't forget to look out for a follow-up email that will have a link to the recording and a registration link for April's webinar on the role of social workers in firearm injury prevention. Thank you again, Chris Knoepke. It's good to see you.
Thank you. It's great to see all of you. Thank you.